board certified surgeon, because there's a lot of knowledge that goes into not just safety, but into obtaining the incredible results. I'm going to shift a little to CO2 lift. So both CO2 lift and hyperbaric oxygen therapy utilize oxygen in their respective processes. In CO2 lift, carbon dioxide is applied to the skin, and the skin is expected to absorb this CO2 and in the process release oxygen, potentially improving skin health. Now, in a hyperbaric oxygen chamber, pure oxygen is administered at increased atmospheric pressure, and the higher pressure allows the body to absorb more oxygen into the bloodstream, which can be beneficial for various medical conditions. The common thread between the two is the focus on oxygenation of tissues, albeit through different methods. Now, I'm going somewhere with this. So comparing CO2 lift to a hyperbaric oxygen chamber suggests that there may be some similarities on how both treatments incorporate the use of oxygen. Now, you are familiar with CO2 lift, and it has been compared to this hyperbaric oxygen chamber. Can you speak to this in your own experience with patients, and what results and outcomes have you found?
So usually our main concern after surgery, and specifically, for instance, when we have flap surgeries, like say a tummy tuck or in a facelift, we have to raise the skin and we have to raise what we call a flap. This flap has to endure some diminishing of the O2 levels, so meaning that we have less vascularization of these areas. Specifically in liposuction, we do secondary liposuctions. We cannot ensure the vascularization as well. So to treat that and to prevent necrosis, we actually have these two powerful tools. One is the hyperbaric chamber. The hyperbaric is very efficient. They actually comprise not only 100% oxygen, but we raise also the pressure. The idea is to raise it to 1.8 atmospheres, so it's 2 times the level of pressure that we have of oxygen normally. That actually compresses the oxygen and makes it literally to go all the way into the tissues, even the tissues that have less vascularization. Provided that, the thing is very difficult to have access to it. It's a very expensive device. It has to be in expert hands, and also it has to be in a specific areas. Sometimes they don't have public ones. Sometimes they have to go to a military hyperbaric chamber. So it depends on the availability that the surgeon has in a specific regions and in a specific city. The CO2 lift is literally what we call a topical. So actually you put it over the skin. And it's a combination of products that actually release CO2 into the skin. The variability is that we usually do that, but we have to inject it. You have to go through a needle, go through the skin, and inject the CO2. The CO2, what it does, it creates a bisodilation. We actually create a revascularization, and we generate more blood vessels. That's the key of providing the CO2. So when I run into this product, I say, okay, what you have in hands is gold here, because it's not only for cosmetic purposes. When I found that they were only used for cosmetic purposes, just for doing the neovascularization of the skin and doing rejuvenation of the skin. But the main point here is that it can provide through the skin, without having to puncture the skin, the same CO2 levels in a higher doses, and even for a higher periods of time than even the injection. So with that, we can have a very powerful tool to induce vascularization in the areas that we have, to spare these flaps, and we have it in a safer, more efficient way with very easy availability as well.
You're preaching to the choir. I personally use the product. I've used the CO2 Lift Pro on my skin. I use the CO2 Lift V for vaginal rejuvenation, and even on...
I can see that.
Yeah.
That was amazing.
I've been using it. I'm a big fan. So I'm glad that that you've also echoed the same sentiments in terms of proprietary uses for this product.